Sleep and rest. Patterns of sleep, rest, and relaxation exhibited through the 24-hour day help determine the individual's pattern. Individual perceptions, rituals, and aids that are used to promote sleep and rest are included in that pattern. Sleep will allow the body time to rejuvenate and respond to the stresses of daily living. So a lack of sleep will affect health and behaviors. Many older adults will experience problems related to sleep. Most humans will develop a pattern of sleep and wakefulness that will repeat over a 24-hour period. This will include the circadian and diurnal rhythms. The 24-hour cycle that occurs in response to the day and night cycle of the sun, and patterns that can be reflected or affected by shift work, time zones, illness, emotional stress, and medication, can change a client's needs for sleep and rest. The necessary amount of sleep will vary, but the average from ages 20 to 60 is 7.45 hours. And this will be affected by the amount of serotonin, norepinephrine, melatonin, and cortisol that each individual secretes. The adult sleep cycle will consist of the pre-sleep cycle, the non-REM or rapid eye movement stages, and the REM stages. There will be 4 to 6 complete sleep cycles that last between 1 and 2 hours each. Each cycle will consist of 4 non-rapid eye movement stages and 1 REM stage. As we begin to age, the levels of our hormones that are associated with sleep will begin to change. We have decreases in melatonin and the growth hormone that will lead to a shifting in the circadian rhythm. Many older adults will feel sleepy earlier in the evening and awake earlier in the morning. Sleep efficiency will also decrease with age, causing many older adults to not feel rested even after they sleep. And some changes are normal, and many are a result of aspects of aging, such as illness, medication, and changes in that circadian rhythm. The risk for sleep disorders will increase as we get older. Insomnia will be the most common sleep disorder, and this is difficulty falling asleep or remaining asleep, or the belief that one is not getting enough sleep. It's frequently associated with underlying medical problems. It can be acute, and this would last 1 or several nights, and chronic insomnia lasts longer than a month. It can be related to medical conditions, medications, psychological, behavioral, or environmental factors. Types of insomnia will be based on the phase of sleep that's affected. We have sleep onset problems related to falling asleep, sleep maintenance problems related to staying asleep, terminal insomnia that's related to abnormally early waking. Determining the type of insomnia will aid in the type of treatment for these clients. Risk factors for insomnia include pain, chronic respiratory or cardiovascular problems, the need for frequent elimination, nocturnal movement disorders such as that restless leg, anxiety, depression, or delirium. Drugs are also likely to interfere with sleep. Excessive environmental stimuli, excessive caffeine, alcohol, or tobacco use, or a sedentary lifestyle. Non-pharmacologically, we can treat it with sleep hygiene education, relaxation therapies, cognitive behavioral therapy, and exercise, while pharmacological approaches will include antihistamines, antidepressants, and most often those will be the benzodiazepines, or hypnotic agents. Sleep apnea is another disorder. It's also called sleep-disordered breathing. The most common type will be the obstructive sleep apnea, which is caused by a collapse of the airways. It is more common in the older adult, and men are more likely to experience sleep apnea. About half of sleep apnea sufferers are also overweight, and these clients will also experience hypertension, metabolic syndrome. We also know that smoking and diabetes are also associated with sleep apnea. Signs of sleep apnea will include excessively loud snoring, periods of apnea that last 10 to 30 seconds, and then a lack of oxygen will cause the person to awaken frequently, and daytime sleepiness, in addition to confusion or loss of short-term memory, etc. An increased risk of cardiovascular complications such as hypertension, arrhythmias, myocardial infarctions, and stroke are associated with sleep apnea. Treatment will include weight loss, avoiding alcohol and sedatives, sleeping on the side, mechanical oral or dental devices that prevent relaxation of those tissues, the continuous positive airway pressure devices, the CPAP, surgery, or a combination of interventions. The circadian rhythm sleep disorders are caused by shift work, jet lag, medications, and blindness causes such as that non-24 where light does not stimulate the brain to synchronize the body clock to the night and day cycle. We have the REM sleep behavior disorder. This is where muscle activity normally inhibited during REM does not operate effectively, and it causes thrashing about in bed, falling out of bed, jumping in their sleep. Manifestations of this disorder may be a predecessor to the development of Parkinson's disease or dementia. Long-acting benzodiazepines or melatonin are frequently used to treat this disorder. The nursing process for disrupted sleep patterns will have a combination of objective and subjective data. We need to watch for fatigue and decreased participation in activities and ask clients how they feel about the adequacy of their sleep and their rest. The goals would be for the client to verbalize an understanding of the sleep changes associated with aging. Verbalize appropriate interventions to promote sleep. Report feeling rested and refreshed on rising. And we'll do this by identifying the factors that contribute to sleep disturbance. Schedule nursing interventions to allow for adequate undisturbed sleep. Plan bedtimes and wake-up times to meet the individual's needs and desires. Allow the individual to maintain rituals that help induce sleep. Assist in providing an environment that is conducive to sleep. Modify lighting throughout the day to imitate normal daily patterns. Provide comfort measures to promote sleep. And administer sleep medications as a nursing intervention of a last resort, watching for side effects. Providing nutritional supplements that will aid in sleep. Promote emotional comfort by spending time listening to concerns. And finally, observing clients for patterns of fatigue or napping throughout the day. So, question. Many medications used to promote sleep can cause and that answer is D, orthostatic hypotension.